versus emotion. I keep hearing the other side state that pediatric doctors say this and pediatric doctors say that. When we hire a doctor, we hire them to perform a function. We don't hire them to decide moral decisions on whether a surgery should or shouldn't happen. We just want them to do it safely. That's what we're hiring them for. So this is a question more for our body than for a group of doctors. Now there's 3 points that I'm hoping that I can provide to you today that I hope we can agree on. The first is America is not the first to this issue. We wisely waited and watched Europe to do this first. Second, gender-affirming care is usually more harmful than helpful. And third, gender dysphoric feelings usually pass. Not saying they should pass, but usually that's just what happens. Now, America is not the first to this issue. The Dutch started doing gender-affirming surgeries in the 1970s already. Didn't call it that, but between 1972, though, and 2015, they only conducted 6,793 surgeries. About twice as many were men to women than women to men. And that's according to an article called the Amsterdam Cohort of Gender Dysphoria Study in the Journal of Sex Medicine from 2018. The article asked, why so few? Well, in the Netherlands, they have this thing called the Dutch Protocol. The Dutch Protocol prevents most surgeries because this is drastic medicine that is only an option for extreme cases. In America, we don't follow the Dutch Protocol. We have already 18,000 youth on puberty blockers just in 2021. Now, lessons we can learn from Europe. First is from Sweden. Gender reassignment surgery kills. Gender dysphoric patients are 19 times more likely to commit suicide after the reassignment surgery. That's from a study from Dejeen Liechtenstein called The Long-Term Follow-Up of Transsexual Persons Undergoing Sex Reassignment Surgery. The second thing we can learn from that same article is gender reassignment increases psychological problems. That same study said that after reassignment surgery, the transitioned needs 3 times as much psychiatric inpatient care. An additional Swedish study conducted in 2020 shows that hormone blockers and gender reassignment surgery does not improve any mental health benchmark. Now, if we look to Finland, in Finland, they have research that said this: gender dysphoria usually passes without any intervention. When it doesn't, it is very, very commonly within autistic children. Our American College of Pediatrics states that 98% of gender dysphoric boys desist from their gender dysphoric concerns and 88% of girls desist from it. In Finland, they found 87% of gender dysphoric girls were autistic. Think about that. 87% of gender dysphoric girls were autistic, and 26% of gender dysphoric males were autistic. So there's obviously some sort of correlation. And as you may know or may not know, autistic children just have an increased difficulty in changing their minds once they make their minds up to something. Now to look in France. In France, they found the driving mechanism creating the phenomena of rapid onset gender dysphoria. They're looking at why this is becoming more popular or more common now than it was 20 years ago and 10 years ago. And what they found, according to their Academy of Medicine, and it had a name for the article, but it was in French and I can't pronounce it, but it says gender dysphoria, the rapid onset of gender dysphoria is a result of excessive engagement with social media and increase in social influence among your own social circles. That's what they said. You can look it up. I can provide you with the quote if you need to. Australia, New Zealand, Denmark, and Norway's medical colleges are all resisting this kind of new increase in interest for gender-affirming care. For example, in Denmark, they're only performing 6% of the requested reassignment surgeries in 2022, where in just 2018, they were doing 65% of their requested reassignment surgeries. And in the United Kingdom, their National Health Service, just in 2022, came out and said in what they call the CAST report, the NHS strongly advises against social transition of children. Now, what do our experts say in America? Actors in Hollywood and reporters from major media organizations will tell you this is settled science. But Dr. Paul McHugh disagrees. Dr. Paul McHugh is a retired psychiatrist-in-chief at Johns Hopkins. He held that position for 26 years. 26 years, this guy was the psychiatrist-in-chief at Johns Hopkins. He also has written 125 peer-reviewed articles and 6 books on this issue. He knows way more than I ever would. After reviewing the history of transgenderism and his conclusions, and looking at Europe's experience, this is what he concludes. Not what I say, this is what Dr. John McHugh says. Transgender is a mental disorder. He notes that no sex assignment is really mentally successful. After surgery, his conclusion, as a psychiatrist, is that these people are not convinced they're the other sex even after the surgery. He further says hormones in our brain's chemical balances are not really convertible. Manipulating these sensitive balances fails consistently. Hormone blockers lead to new mental illnesses. And he basically explained it this way. Transgenderism is more like anorexia. An anorexic person can weigh 80 pounds and look in a mirror and they see someone who's fat. A very similar thing is happening, according to Dr. McHugh, when a gender dysphoric person looks in a mirror and sees the other gender. He points to a Vanderbilt study that showed that after reassignment surgery, patients are 20 times more likely to commit suicide. So think about that. In Sweden, they found 19 times. Vanderbilt, they found 20 times. There's obviously something important here to learn, and that's that gender reassignment surgeries kill. Further, the reassignment surgeries, in his words, come very close to child abuse, since 80% of those kids seeking the surgeries will eventually abandon the confusion and grow naturally into the adult life if untreated. He says, claiming that this is a civil rights matter and encouraging surgical intervention is in reality collaborating and promoting a mental disorder. Now, I have strong feelings that this is wrong, but I'm not the psychiatrist-in-chief at Johns Hopkins. I've not spent nearly as much time thinking and working on this stuff as the Europeans. But the experts who put medicine and ethics ahead of their politics are obviously and rightfully very concerned. This is wrong. When in history has it been productive to cut off one of your child's body parts? Is this common sense? Allowing an adult to do a reassignment surgery seems sadly necessary to preserve our freedom from government. But we restrict children from many things, like smoking cigarettes, to protect their lungs. If we are protecting their lungs from cancer, shouldn't we also protect their sexual organs from gender reassignment surgery too?